Hi everyone, I'm Dr. Shitij Arora. I'm a professor in medicine at Albert Einstein College of Medicine, New York, and I'm co-founder of Community Science Alliance, which is an organization addressing the critical issue of lack of contextualized evidence-based pathways in India, um, and extrapolating it to other resource limited settings. I'm here to share my experience using artificial intelligence in the context of global health, and specifically something that we have been doing with the Community Science Alliance. CSA's core work involves writing evidence based medicine pathways which address the resource limitations. So they are hyper contextualized. For example, in here, somebody comes in with chest pain, you do troponins, you rule out acute coronary syndrome, and then the triage happens. Troponins are not available in many of the settings in India. So how do you then practice evidence-based medicine in keeping these resource constraints in mind is something that we have been doing as an organization in the last 3 years now. Now that the pathways are written, we have been exploring ways for these pathways to be made available to the providers in India. India is a unique healthcare system where informal healthcare providers are critical in providing help to the patients. These providers are a critical part of the rural India's healthcare system, frequently lack formal medical training. Therefore, AI solutions designed for these providers, one, will be helpful. Second, it must consider the unique needs and constraints such as limited digital literacy, language barriers, cultural beliefs. For example, any AI-powered training program or diagnostic tool should have very simple interface, local language support, and culturally sensitive content. So, keeping all this in mind, and with the pathways that we have written, we are now in the process of developing a tool called Fingertips, which is a use-based AI solution for rural India. It's a conversational AI tool to support clinical decision making for 122 most common conditions in rural primary care settings. It addresses contextual challenges by focusing on specific use case, incorporating local language support, and leveraging a rigorous validation process in real world settings. Um, the fingertips and supported by research which has been done by Jishnu Das and colleagues highlights the importance of data driven approach to AI development in respect to global health. By collecting and analyzing data on user interactions and outcomes, developers can gain insights into the tool's performance and identify areas for improvement. This iterative process of development and refinement is absolutely crucial for creating AI solutions that meet the needs of users and address the challenges of specific contexts. A strategic approach to AI in India um, is really focusing on contextualization and use case based development. India's 1.4 billion people, and I think a prime um, setup for AI to succeed, provided it addresses the contextual challenges. I look forward to meeting all of you in October, and I'll share more of my work then. And see you. Bye.